Hi, my name is Katie Rietta, Clinical Educator with Dermaspark. Today we're going to be going over the practical training for the Twist Microneedling System by DermaRoller. Before we start, please ensure that you've already completed the theory portion of the training prior to doing a hands-on treatment. First, we're going to start by showing how to load the needle cartridge. The device should have been already sanitized and covered with protective plastic film. To set the machine, we first go to 0, 0, and that's our baseline. Then if we wanted to do a 0.25 infusion, we would go to 0.25, 0.5 for forehead, for instance, 0.75 for cheek. The 0 and the 1 would indicate 1 millimeter into the skin. That's a deeper treatment for cheek and thicker areas. 1.25 and 1.5. You'll see the indicator here of 1 and then 0.5. That's how you set the depth. On sanitized skin, she's been double washed and wiped down with alcohol. I'm going to apply a small amount of hyaluronic acid, and I am going to start just very shallow. I'm going to hit my foot switch to start my machine and make sure your skin is pulled nice and tight. And I'm just going to do a few circles to see what her skin response would be. She's just barely pink, so I'm going to increase it up to 0.5, which probably 90% of the forehead treatments are done at 0.5, so that's usually a really good depth for foreheads. You can see a little bit of pinpoint bleeding here, even at the 0.25. There's 1 dot or 2 dots, 3 dots. They look more like red pores. You shouldn't see a significant amount of blood. And I'm going to put another little dollop of hyaluronic acid, keep her skin nice and tight. And this is at 0.25. So I'm doing nice circular motions in a linear pattern, and I'm going to go right across the entire forehead. I move quite a bit because I don't, it's much more comfortable for the client. I'd rather do nice elongated pattern and allow the skin to really recover and the client to be much more comfortable, and do several passes. You can see she's pinpointing here very nicely at 0.5. I'm just going to do another. The circles shouldn't be too small or too big. And typically I'm probably doing about 4 passes. In her case, she's pinpointing quite nicely, so I'm probably going to do 3 passes altogether. That was 1, 2, this is the 3rd. Maybe I'll do 4. And her forehead is finished. Now I'm not going to increase the levels at all. I'm going to be doing under eye, upper lip, and chin. Those are all shallow areas, so I'm just going to start my treatment at 0.5 as I did the forehead. Nice linear. It's more sensitive on the upper lip and on the under eye, so I'm not going to be, she's helping me here with some movement, which is great because it keeps the skin nice and tight. Notice I don't have hyaluron all over the place because I like to pull my skin so that it's really nice and firm. And you can see she's pinpointing just nice in these areas. Once she pinpoints, I just go over the area again and I just blend it in. Just like this, so you don't have petechiae is showing or anything like that. That will just be absorbed back into the skin. Now I'm going to do the cheek area, and I'm going to be going a little bit deeper. So I was at 0.5 on the thinner areas. I'm going to go to 0.75. That's a great place to start. If someone had acne scars or something like that, you could go deeper, 1.25, even 1.5 on those areas. But just on the areas of scarring, it's really not necessary to go that deep for skin rejuvenation. I'm just doing circle pattern, and this is at 0.7 in a sort of a linear motion. And I'm doing each pattern about 4 times. That was 1, 2, 3, 4. Then I'm just gonna do another dollop and move over. I'm gonna overlap where I was a little bit. So I'm quite methodical how I'm patterning the skin, because I wanna make sure everything's punctured equally. So I'm working from the inside of the face outward, so everything is nice and even, and I'm not having to go up back and touch areas that I've punctured.